A pram waiting for a baby who never came home. The cot she never slept in.
My mum, who was with me, who was shouting at them, "There's a problem with the baby, you need to do something." Eventually they did an ultrasound scan and Beatrice's heart had stopped and she was dead.
Beatrice died before she was born on May the 20th last year at Barnsley Hospital. So much appears to have gone wrong, including not reading the heart monitor correctly and not moving Emily to the labour ward fast enough. She has spent the past year asking questions, not just about how this could possibly have happened, but in fact about the subsequent investigation into her baby's death.
So you've done actually quite a lot in the space of less than a year.
Yes.
Is it helping with you?
I don't know what else to do with myself. Everything else that used to interest me and occupy me, it just doesn't matter anymore. And, you know, I'm Beatrice's mum, and because she's dead, this is the only way I can be her mum. And so this is what I'm doing.
Emily's focus has been on this, the Healthcare Safety Investigation Branch, or HSIB, but specifically its maternity programme.
We work closely with patients, family members and healthcare staff to identify faulty systems or procedures which may cause patient harm.
Set up in 2018 to independently investigate harms and deaths in maternity units across England with a £16 million annual budget.
They haven't made a difference. They haven't made a difference. There's all kinds of things wrong in my view. The way investigations are conducted, I don't think it works. I don't think it fulfills its purpose. But possibly more important is that when HSIB reaches conclusions about what happened in a case and what went wrong, they don't have any way of enforcing change. It doesn't have any teeth.
This is how HSIB maternity works. If the family wants it, an investigation is started. A maternity investigator will take a detailed account of the family's version of events, and they also conduct interviews with staff and gather evidence from the trust. This goes to a panel made up of clinicians, and a report is written. The aim, to identify common themes and influence systemic change. Emily Barley's story of her daughter's birth is hard to listen to, especially when you know the outcome. A labour that wasn't progressing, problems with the CTG to monitor the fetal heart. At one point they read her heart rate rather than the baby's. They didn't escalate the situation in time. Records were written after the baby died. At least that's what Emily and her mother, who was with her, recall.
So give me an example, for instance, where HSIB has said, on the balance of probability, we believe the hospital records and not the...
They haven't, so they haven't even done that. They've sort of said, through my report, this phrase is repeated, we cannot reconcile these differing accounts. It's in there loads, and that's where I've said one thing and members of staff have said another thing.
And other families have said this to us too. If their memories don't match those of the staff, they claim the reports will either side with the clinicians or use that phrase, can't be reconciled.
At the moment, the situation is that unless staff will admit to something, then it doesn't go in. And that means that an enormous amount of learning is missed.
Emily reinforces her point with this. From December 2019, HSIB maternity safety recommendations to Barnsley include escalating when there are problems with the CTG or fetal heart reading, ensuring members of the obstetric team receive senior support, or the trust to ensure a decision about expediting birth is considered if a baby's well-being cannot be assured. So safety recommendations made, and yet it still happened again with Beatrice. Barnsley Hospital apologised to Emily and said,
"All incidents are taken very seriously, and every investigation, including those reported to HSIB, results in an individual action plan. All recommendations from HSIB reports are incorporated directly into service improvement plans."
HSIB said the maternity investigation programme had received in total 19 complaints from nearly 3,000 investigations, mainly relating to timeframes and communication, with very few highlighting the quality of the reports. HSIB was set up to improve England's poor record of baby and maternal deaths and injuries.
About 1,000 incidents annually will be investigated not by the trust at which the incident happened, but independently with a thorough, learning-focused investigation conducted by the Healthcare Safety Investigation Branch, HSIB.
Given that millions of pounds have already been spent, how successful has it been? When asked how many maternity incidents met the criteria for an HSIB investigation, Freedom of Information data shows between 2019, when it became fully operational, and April this year, the number of referrals for babies with potential severe brain injury was down 19%. The number of referrals for neonatal deaths was down 21%. But stillbirth referrals have increased over that period by 63%. And HSIB said maternal deaths were underreported in 2019, but from 2020 to 23, they said the figures were stable. In response, HSIB said the maternity investigation programme has had a positive impact on maternity safety in the areas it could influence. So HSIB maternity set up for the very best reason, to reduce harms and deaths in birth. But it hasn't been a resounding success. You can see that in the figures. And now Channel 4 News can reveal that HSIB staff themselves have made repeated warnings to their bosses that there are fundamental flaws within the programme. We've been leaked numerous documents. We've been contacted by whistleblowers. We've spoken to families. Jeremy Hunt himself has been told there's a problem. And in this leaked email, one insider says,
given the high potential for harm, consider putting some or all maternity investigations on hold until near-term actions are complete. A seriously flawed investigation is worse than no investigation.
It's dated November 2021, 6 months before Beatrice died. The email warning carried on under the heading, the potential for harm.
Harm to staff involved in incidents that are implicitly or explicitly blamed in reports. Harm to patients and families that are left with an inaccurate picture of the causes of adverse events. Harm to organisations that are not able to learn or learn the wrong things from events. And harm to future patients, families and staff where issues are going unrecognised and unaddressed.
HSIB said in a statement,
our remit is solely to conduct professional maternity safety investigations and to share recommendations with the trusts and the families involved. We do not have the legal powers to enforce the trusts to enact our recommendations, but we always escalate any immediate concerns.
And Mr Hunt's spokesperson said that when approached by concerned HSIB staff while chair of the Health and Social Care Select Committee, he had passed on concerns to the relevant minister. None of these findings surprise Alex Barr, whose baby Marnie died in April 2020 during labour. She too had an HSIB investigation.
It did obviously highlight a safety recommendation, which was good to see, because when you're in that sort of state of mind, when you've lost a baby at full term, you probably can't always see these things in front of you. So that was good, but there was no value in the fact that I don't think anything's been done about it. And, you know, they can't enforce these recommendations. They can only, you know, highlight it and suggest that the trust makes changes.
Alex Barr, however, disputes a fundamental part of the report. She says that she warned the staff that when her waters broke, there was blood, and that can mean there is a serious problem. Yet she was sent home and hemorrhaged. The report does not acknowledge her warning. It is their word against hers.
It seemed to be acting in the favour of the clinician at the time, and we didn't really agree with that because we had our opinion of the events too. So they did change that in the report, or so I thought, but there is a section on there and it does still have that opinion, which is not my version of events of what happened.
In fact, Alex tells us she was a nurse working in dialysis. She says, quite frankly, she knows blood when she sees it. Insiders have told Channel 4 News that the maternity investigators, those that have the first contact with the families, are overwhelmingly good and enthusiastic people, but that it is the process that isn't working. Now, HSIB Maternity was to become a special health authority. Legislation had been passed, and it was hoped that this would give it more teeth to enforce change. Instead, it was suddenly announced recently that it will be hosted by the Care Quality Commission. And those same insiders now say that they fear that change will never happen.
I speak to so many families who have completely lost faith, and it's almost worse that they think they're going to get the answers in an empathetic way, and they keep getting let down time and time again. So it's not just about having authority, it's about a more robust way in which HSIB work. And I truly hope that they take these concerns seriously and they make positive changes.
Countless families, like Emily and like Alex, have relied on HSIB maternity investigations not just to hear their stories, but to find their way to the truth. And above all, to ensure that lessons absolutely are learned. And now those families are asking, what was it for?
And we'll be showing the second part of Victoria McDonald's investigation tomorrow night. If you have been affected by any of the issues in that report, go to channel4.com/support to find a range of places to seek help.